one of the biggest shifts I'm helping independent practices solve right now is treating MIPS and HEDIS like completely separate systems, when in reality, they're often tracking the same patient, same condition, and same care gap with tweaks in definition. They're looking at separate reports, separate measures, separate workflows, and separate improvement projects. I think that's the problem and where a lot of them are getting stuck. So instead of organizing your quality improvement around reimbursement programs, we want to organize it around patient population.
Here's what I mean. A patient can be on Medicare Advantage this year under HEDIS because a rep told them it would be better. Now they're having problems with authorizations, so they switch back to traditional Medicare the next year, which is under MIPS, because they want all of their home health visits and they don't want to have to deal with authorizations. Same patient, different reporting programs with different metric requirements 2 years in a row. So what happens? Teams end up attempting to reorganize the practice workflows every time the reporting program changes to satisfy requirements. Why? Because MIPS changes, HEDIS changes, insurance changes, measure specifications change, the patient change plans. This becomes exhausting and highly ineffective. Meanwhile, diabetes doesn't change, hypertension doesn't change, heart failure doesn't change. The patient hasn't changed unless they're improving. So why are practices organizing improvements around reporting programs instead of the disease they're actually treating? Instead, the workflow should support caring for the patient population regardless of which reimbursement model it's attached to. Because when it comes to MIPS and HEDIS, at their core, both programs are evaluating whether practices are consistently delivering preventive care, managing chronic disease, and improving outcomes across their patient population, and doing it with a low yearly cost for their patients. So we essentially need to know, how are our patient populations performing? Why are they performing that way in the first place? And where the current patient pathway is breaking down to allow it. You find that through your operational practice story. Before I recommend a single improvement, I want to understand 4 things about the practice. Who are we responsible for, meaning which patient populations and the numerator and denominator for each? How are those populations performing? Which population is creating the greatest operational and financial risk? And can we see it in real time? Because if we only know these numbers after the year has closed, we lose the opportunity to make changes that avoid penalties. That's why my entire approach focuses on helping practices understand the full story behind their practice performance first. We want to find out if the patient pathway and operational workflows are misaligned with quality goals overall, not just for MIPS or HEDIS. We need to know exactly where the pathway itself is hurting outcomes instead of reacting to disconnected reports one at a time years later. Once we pull all that data, we start asking different questions. What story is the patient population telling us? What's driving the poor performance? Is this a documentation issue, a workflow issue, a patient follow-through issue, a billing issue, or something else entirely? Because once you know the story, the right improvement project becomes obvious. The workflow that's breaking down becomes obvious. The documentation gaps become obvious. The billing issues become obvious. And where to intervene first becomes the most obvious. I don't start by asking which measures should we improve. I start by asking, why is this practice performing this way? What are the limitations of this specific practice that's making the quality, the performance, the metrics look this way? If your practice has experienced penalties, declining scores, or reimbursement instability, follow along, because that's exactly what I talk about here. And if you're looking for help in this area, I have a question, feel free to reach out in my DM. I'll see you in the next video.